Hi, I'm Dr. Chloe Carmichael, clinical psychologist and author of Nervous Energy, Harness the Power of Your Anxiety. So I'm here to share with you guys about something that I think is really important as a clinical psychologist, and that is the subject of free speech. And I know that free speech is becoming a super hot topic these days, and it's seems to have even a lot of controversy around it, to the point where I think a lot of people have even become afraid to speak their minds because they're so afraid of being canceled or of being misunderstood or, of saying the wrong thing. And as a clinical psychologist, I just really believe that it is very important that we don't allow anyone to stop us from freedom of expression and open dialogue, and that we don't try to stop other people from having their own freedom of expression and their own open dialogue. Because, again, as a clinical psychologist, I can tell you there are so many mental health benefits to being able to put our thoughts and feelings into words. And sometimes that even actually means we discard things that are actually not correct or not right. Who hasn't had that experience of saying something aloud and then realizing, okay, wait a minute, maybe I need to reconsider that. As I say it aloud, it doesn't sound quite the way I meant it, or what have you. But we can't get to that point if we just have to pantomime whatever, is the correct speech of the day, if we don't allow ourselves our own process of thinking through and talking through our feelings. And so, to that point, I wanted to go through this blog that I wrote about this topic. It has three main points in it about the benefits of free speech for mental health. So the first one I covered a little bit here already, which is that free speech does help people to learn and grow, just cognitively being able to put your internal life into language and starting to choose thoughts and labels, words for your thoughts and feelings actually helps you to develop a healthy separation between your thoughts and feelings and your core sense of self. It starts to allow you to do what psychologists call externalizing your thoughts and feelings. And when we can externalize them through language, that's when we're actually better able to even change and discard them or update them if that's what needs to be done. That's how we develop ideas and discover them. And as I said, even sometimes discard them is oftentimes through talking them through and exchanging and getting information from other people. Now, the next one, this might seem counterintuitive, is that free speech helps safe spaces. Now, I know some people want to limit free speech in order to create safe spaces. Here's why, as a psychologist, that doesn't actually, to me, really make sense. So when we prevent people from speaking their minds, their thoughts and feelings don't go away. They just go undercover. And so for me as a woman, for example, I feel so much better actually knowing if somebody thinks that I'm inferior because of my sex or, whatever the case may be. I want to know. I'd much rather hear how people really feel so that I can determine if I want to be around them, if I want to persuade them, whatever else. Now, that does bring me as well to this little caveat, which is that free speech does not mean that we have to listen to anything anybody says. We can choose, and we should choose, to be careful about who we let into our inner circle, what news programs we listen to, all of that kind of stuff. But that doesn't mean that we need to stop the right of other people to say those things in the first place. Another issue I have about the idea that free speech is somehow counter to safe spaces is because it kind of goes with this idea that words are violence, which I'm here to tell you is not true. And I think it's a very disempowering way to live your life as a speaker as well as a listener. So, as a clinical psychologist, when I assess a patient, it is part of my legal duty to find out if that patient has thoughts of harm to self or others. Are they planning to go harm physically themselves or others? And if they are, I have a legal duty to intervene and to, call the authorities or whatever to stop them. If the patient says that they have a plan to go tell off their neighbor, it is absolutely not in my legal right for me to try to interfere with their plan, right? And the difference is clear is because one situation involves physical harm to others or self, and one does not. Now, I'm not saying words don't have the power to hurt. They obviously do. As a psychologist, I know that too, but it's quite different from physical harm. And just to be very vulnerable and open here, I'll share as well that I, in the past, was a victim of very severe domestic violence. And thankfully, I'm happily married now for nearly 10 years and nothing to do with my current husband, who I love very much. But in the past, I had a really terrible situation, those things that probably nobody ever thinks will happen to them. And through that experience, I can definitely tell you that there's quite a big difference between physical violence and hearing things, having someone say things that feel hurtful. And like I said, it's actually a disempowering position for the speaker as well as the listener, because obviously we don't want speakers to feel intimidated and like they can't think things through because God forbid they say the wrong thing and then they're stunting their own growth. But it's also disempowering for listeners to have to live your life fearing that God forbid your ears get exposed to the wrong thing, that's in any way the same as, somebody taking a knife and stabbing you. It would be a very anxiety provoking way to live your life in fear, that God forbid you may hear the wrong thing. Now, getting to the third point here as well about the mental health benefits of free speech is, as a clinical psychologist, I do think that free speech may help to reduce anxiety and depression for a couple of reasons. As I mentioned earlier, putting our thoughts and feelings into words puts them obviously into a system of language. And psychology studies have shown that that helps people to have a sense of control over things when they can start talking about it and being specific about what they think and what they feel. It's empowering. That increases our sense of control. As we increase our, what psychologists call internal locus of control, our own personal sense of control, that's actually a protective factor against anxiety and depression. One of the hallmark features of depression, for example, is a sense of helplessness. So learning to put things into words is actually quite important for our mental health. Also, when we can put things into words and share them and have good talks with other people, that's how we have social support. Social support is another known protective factor in mental health. So if you can't even really have a heart-to-heart with people or talk to people because you're afraid that they would cancel you if they knew what you really think, or that they would, God forbid you say the wrong thing, how can you really have intimacy and authenticity and true high quality social support, right? In fact, I would think it almost becomes like the opposite if, by constantly masking yourself and hiding yourself, the message you're sending to yourself is, that you're not acceptable, that you're not worthy. It's almost like the opposite of social support. One final point on this is that free speech, I think, may help to increase self-awareness. That's part of what happens in a therapy session is somebody comes in, they talk things through, and it's through that process of paying attention to themselves and putting their feelings into words that they really discover what's happening with them, what they really think about things, and then they can, be proactive and make choices about if they want to change some of those things or revise some of those things, or whatever it is that they want to do. But if people don't have the chance to talk things through in an authentic manner, what can actually happen is that they can go into denial and they can lose touch. They can suppress and repress those parts of themselves to the point where they're not even in touch with themselves anymore. And then they don't know why, but they just find themselves, suddenly feeling really anxious when they're in a room full of people and they don't know why. And, maybe the reason is because unconsciously they have a terrible fear of saying the wrong thing, or because they've kind of lost touch with who they really are because they've stifled themselves. So I think, in terms of a conclusion here, I think, I'm just going to go back to the full camera here. and say, in terms of a conclusion, again, that I really want you, if you're listening to this, to know that you can and should speak your mind, say how you feel. You can even change your mind. It's okay to be wrong, even. And also, please try not to stifle the speech of others. You may not like what they have to say. You can choose that you don't want to hear what they have to say. But I believe it's damaging not only to others, but to ourselves to live our lives feeling that we cannot possibly stand to hear or allow others to say, things that we disagree with or even things that hurt us. So thank you for letting me speak my mind and share this with you. I'd love to hear any thoughts you have in the comment section or DMs or whatever which way that you want to reach out and let me know. So here's to you and your free speech. Have a good rest of the day.